thundering outside, sorry. Thank you so much for being here. My name is Stephanie Durzapolsky. I'm Chief Communication Officer at Tallahassee Memorial Healthcare. I know many of your names and faces, which I don't see, but hello and good afternoon. I know over the weekend I had posted something on my personal social media, which got a lot of attention, and many of you had reached out and asked to interview me. And really, I'm not the one with all the answers. And I just felt it would be better if we had the clinical leaders speak to this. There's a lot that's even happened since I made my post yesterday. So again, just wanted to punt it to our clinical leaders. So I'm going to start with Dr. Dean Watson. Dr. Watson is our Chief Integration Officer, and he's actually works with both Tallahassee Memorial Healthcare and Capital Health Plan. He is a internal medicine physician, and he really has been our one of our COVID and our vaccine experts throughout this whole pandemic. So Dr. Watson, if you don't mind unmuting and giving us a status update of how things sit right now at TMH.
Sure, and good afternoon, and thanks for taking the time. So really over the past few weeks, we've seen a tremendous increase in the number of hospitalizations. Most of this obviously is due to this surge. And unfortunately, we had to suspend the majority of our elective surgery cases requiring overnight stay or inpatient stay. And that'll go on at least through August 6th. We'll be monitoring this truly on a daily basis. We continue to be able and we continue to take care of urgent and emergent cases. We're still here for the community, clearly. As of today, the 2nd of August, the total number of patients it fluctuates on an hour-to-hour basis, but at least 70 patients admitted within Tallahassee Memorial Healthcare System. 12 of those are in intensive care units, one of which is a pediatric intensive care unit patient. 11 are adults. None of these folks were vaccinated. Of all of the patients that we have in the hospital, only 4 have been vaccinated. Again, reiterating that this is a unvaccinated pandemic. Most of this can or could have been prevented. And as an organization, we continue to emphasize the importance of vaccination. It truly is the best tool to prevent further infections, and it will help us reduce the continuation of this current crisis that we are in. And again, individuals that have been vaccinated that end up in the hospital do reasonably well in comparison to those that have been unvaccinated. So it's very important to get vaccinated if you're eligible and capable. In addition, as we look at moving forward, where are things headed? We like to look at the UK numbers because they mirror us somewhat when it comes to vaccination. Actually, they're doing better than we are when it comes to vaccination, but they're trending down now. We hope to see a trend down over the next 4 to 5 weeks if everyone will get out, get vaccinated, do the right thing. But we are going to continue to see an influx really over the next 2 to 3 weeks before we start to see any trends. Our positivity rates continue to be high. We hope to see that trend down over the next few weeks as folks decide to take personal responsibility and get vaccinated. So what we'll do next is we'll have Ryan Smith, who's our Chief Nursing Officer and our Chief Clinical Officer and Vice President here at Tallahassee Memorial Healthcare, to talk about the current state from the operations standpoint.
Hey, thanks, Dr. Watson. Good afternoon, everybody. Thank you for joining us. As we mentioned, we are currently experiencing the highest hospitalization we have seen to date. Our units are at max capacity, in which TMH created new units to best care for these patients. We're going to categorize the units based off the acuity of patients, and we have a color-coded system to have lower acuity, medium acuity, and high acuity, and place these patients in the appropriate location. In turn, we're also looking at staffing models, and we're implementing new staffing models starting tomorrow at 9 o'clock. And our goal is to make sure we have adequate resources from a staffing perspective to take care of our patients, as well as have adequate resources to support our nurses, our clinicians, respiratory therapists at the bedside. So to support all of our colleagues, we're enrolling and implementing a staffing plan to ask our indirect staff that have clinical competencies to rejoin us at the bedside. So individuals such as leaders, patient navigators, educators, organizational improvement advisors, to pick up a percentage of shift at the bedside to help augment our staffing to make sure we have adequate resources to care for the COVID patients of the influx and the spike, and to make sure that our staff do not burn out. And we can't emphasize enough, and it's just as Dr. Watson and Stephanie has said, the COVID vaccination is the key to get us out of the crisis that we're in. And it really is, consider it for your family, consider it for your loved ones, consider it for patients, and consider it for your healthcare team here at TMH and other healthcare providers working across the nation to care for these COVID patients. I'm gonna turn the floor over to Stephanie.
I know we have a couple of questions that have come in. One, how many COVID patients did we have in June before the surge? I know you both kind of have a general number.
For sure. Before the surge, we were optimistic, and I think we were falsely optimistic to think that we were trending down. We were down to less than 5 patients a day. We were averaging, in that window of 0 to 10, 5 was our average, and it was pretty consistent. And then the spike happened, and it happened pretty rapidly, and we doubled and tripled our census, within the matter of 3 weeks.
Someone asked why are we having a spike now?
So, and Dr. Watson can allude to this and explain further, but we now have the Delta variant in our community that we haven't seen before. This is the new variant of COVID-19 that is relatively new to our community, and I think a large part of the spike is due to that Delta variant. Dr. Watson?
Yeah, I agree with that. And remember, as we got out and did more things and felt more freedoms, and people were, which is a good thing. People were not wearing masks as much anymore. And so really it's just that gathering, getting back to normal. The unfortunate part is this Delta virus is no joke. And we knew as healthcare specialists, when we were seeing really in our local area, less than 50% of individuals getting vaccinated, we knew we were in trouble. So this is not a shock to us. It's an unfortunate outcome that we saw coming, and we are just beside ourselves with sadness, with angst, watching these people suffer in the hospital, and when the majority of these could have been home safe, healthy, and doing well. This is all could be prevented. So again, when you have 18 and over, 50% in Leon County being vaccinated, and 12 and over, less than 50%, that's the issue. And so we all need to get together and have real conversations about this, and talking about personal responsibility, looking at the evidence behind these vaccines, who are still 88% effective against the Delta variant. I mean, I'll take that all day long. And we really need to take this very seriously.
Any other questions from the media? I think our point here today is to emphasize that this is a serious enough situation that we have entered into an emergency operational type of plan. We have reached our capacity and are having to develop out-of-the-box ways of caring for patients, which include pulling people who aren't traditionally doing bedside care to care for patients. And we are having to set up new units, new areas in the hospital to care for these patients. And I just want the community to understand the situation that we're in. There is a question, were the 4 vaccinated patients in any way especially vulnerable?
Yeah, so that's a great question. And I forgot to mention this prior, is that the majority of the people that are in the hospital that are unvaccinated are reasonably healthy. This is what the Delta virus the Delta variant is doing. It's identifying and going after individuals that typically in the past we would have said, nah, they're going to be fine because they're 25, 26, 30 years old and doing well. Not the case anymore, folks. We've got people that are 20 years old. We've had people as in their 20s that are not doing very well at all. Typically, they're more in their 30s and 40s, filling us up. 20 to 60 is the age range. The 4 individuals that are in the hospital had underlying healthcare issues, yes. But the majority that are coming in unvaccinated, it's a new day and age. These folks are reasonably healthy.
I have a question. Am I able to just ask Stephanie?
William, is
Stephanie,
that
are you
you?
there?
Go ahead.
Yes, yeah, this is William Hatfield with the Democrat. Along that same line, can you give us an age or a range of the pediatric patient and how rare is that case?
Well, we actually had two cases in the hospital. One was very young, one is very young, and the other is 12 years old. Obviously, 12-year-olds getting COVID is not rare. The highest number of folks getting, or the age range for folks getting infected really is below the age of 24, because they're out and about, and it makes sense, right? The youngest one was under the age of 1, and yeah, that's not common.
Brian, I think this is probably a question. Oh, sorry, William, did you have a follow-up question?
Yeah, but if you were going to expound on anything there, that's fine too. Or do you want me to just fire away?
Go ahead.
Okay, can you describe what it's like in the ICU and kind of these COVID wings? I mean, I imagine it's pretty emotional for the healthcare workers. I mean, they've been through this before, but they were through it before in a very different circumstance than what it is now.
It is. It's a challenging environment. I will tell you that, as Dr. Watson, that the biggest difference and change between the last surge and this surge is it's now attacking a younger population, individuals that are on the surface healthier, individuals that we now are seeing longer hospitalizations, more intense care, because in theory you may have a healthier immune system in these individuals now that, and before, when it was, attacking your elderly population, you didn't have that immune response. So our hospitalizations and the length of stay have increased. Our intensity to treatments, they have increased as well. The COVID units, it's a challenging environment. Your clinical staff are dressed in PPE, your protective equipment, at all times, and have masks and gowns and garbs and everything else on, and balancing that with supporting families, through telephones and telemedicine and communicating and helping the patients, overcome this sickness, this virus. It's emotionally and physically draining. So, it's an intense setting for the staff, and it's something that we never faced in healthcare before.
Ryan, one of the additional comments I would make to that is, and I think that was well stated, is that from a physician standpoint, provider standpoint, nursing standpoint, respiratory therapy standpoint, we're dealing with something that could have been prevented. And so when you're entering into that environment, it's hard because you're sad for the individual. You have angst for the family. You have empathy, but you also have anger. And that's kind of that mix of things that you have to work through, because as they're treating the patients, they want to make sure that they show enough empathy, that they show compassion, but they're human. And so just dealing with that, recognizing that you have all of these poor individuals in the hospital that did not make the right choice, that did not take that personal responsibility overly seriously. And now, unfortunately, they're battling through. And to Stephanie's point, as many of them are asking, can I get vaccinated now? And at that time, it's too late. And that just breaks our heart. So you deal with all of that mix, and it's a lot emotionally.
A couple of questions in our chat. I guess probably Ryan, for you, the original COVID wing held around 35 COVID patients. Was a new wing created to house the others?
For sure. So we have now, as we entered the conversation earlier, we've now exceeded the capacity of our original wing. We're creating an additional floor that will take the lower acuity COVID patients that are more stable. And then the traditional COVID wing that we have used, the 35, will be at the medium level of care for these COVID patients. So this net new wing addition is to care for additional patients, which we're looking at starting in the 10 to 15 patient census window.
Is there an ideal number of COVID-19 patients there needs to be in order for elective procedures to come back?
We don't have a number set in mind. I think we're going to have to track it each day and each week and look at the positivity rate, look at resources. And I think you'll see when you see the trend going down, when you look at your positivity rate in Leon County start trending down, hospitalizations typically fall 10 to 14 days after that. So, we're looking and watching each day. Hopefully that positivity rate in Leon County trends down, or weekly now because of data, but hopefully that positivity rate trends down. Hospitalizations will then follow 10 to 14 days after that, and then you'll probably see a shift back into surgical schedules at a scheduled rate as opposed to just opening the floodgates. That this is going to be a period of time that we trend down slowly, and then we'll slowly build back up.
How much is too much in terms of patient numbers, where you have to like consider a field hospital or I mean, obviously, you know, you're expanding into wings, but I imagine even that's a finite situation. And if the influx is supposed to continue for the next 4 weeks, when is a capacity that you can't, where you lose that flexibility?
We have plans in place and room to expand at TMH, and it's looking at your resources, look at staffing. You know, it's taking measures in place like we have done today to look at, you know, what clinically capable staff do we have that can perform direct patient care by not burning out just our frontline staff here. You know, right now it's a moment by moment, week by week, you know, snapshot of time of, you know, can we adequately take care of the patients that we have? We believe we can. We've put measures in place to expand to take care of those patients. At this point, you know, hopefully with the projections and the growth, you know, we feel comfortable that we can take care of the patients as this curve continues to grow. We don't have a set number to say, when do we reach capacity? We're flexible and nimble to take care of the volume that needs to be taken care of in our community.
Thank you.
Any other questions before we get off the Zoom? All right, well, I guess that concludes our interview session. And thank you to Ryan and Dr. Watson for participating, because I know they are burned out and tired of this, but we also want to make sure our community is informed. So thank you.
all.
Thank you all for doing this.
For sure. Take care, everybody.